Well, we've been speaking with top experts to help us think about how we get through this pandemic and how we get back to work. Today, we're joined by Dr. Scott Gottlieb. He's a CNBC contributor, a senior fellow at the American Enterprise Institute. He's on the boards of Pfizer and Illumina. Thinking about getting back to work and getting back to business, what do you think that path actually looks like over the coming winter months, getting into next year? When and how do we actually get back into work so I'm not interviewing you from my attic TV studio that CNBC set up for me?
Well, look, I think we're transitioning from the pandemic phase of this virus to a more endemic phase, meaning that this is going to become a persistent risk, a persistent virus that circulates every year, much like influenza. And there's not a clean line demarcating those two sort of states of fitness. It's going to be messy, and it's going to be unclear when we're kind of out of the pandemic and this is more of an endemic virus. It's something we're going to know when we look back a couple of years from now. On the back end of this, we are going to be entering a more endemic phase of this virus. I do believe this is the last major surge of infection. Even if you see new variants, they're likely to emerge within the Delta lineage, and hopefully we'll be able to vaccinate against them in the future. And so that question becomes, how do businesses deal with the fact that COVID is going to circulate like the flu? I think it's going to be a risk at least on par with the flu, and we already have a flu season. And so if you sort of layer on top of our ordinary flu season, now a COVID season, and it causes a similar amount of death and disease, I think the total hit on public health and also productivity is going to be too great for us to sustain and just be business as usual. I mean, the productivity impact of the flu season every year is in the tens of billions of dollars, both direct and indirect costs, and this on top of it is just going to be too much to bear in my view.
And we really didn't see any flu in the last year. A lot of people attribute that to the masking, the social distancing, and the hygiene that we practiced through COVID, which didn't work for COVID, but it apparently worked for flu. What are you expecting this upcoming winter flu season when we're perhaps not doing those things quite as much?
You're right, we haven't seen a flu season last year. We're in for a Whopper because we haven't put immunity into the population in at least 1 and maybe now 2 years. When flu does come back, and it will come back, it's going to come back very aggressively because you're just going to have a population that hasn't had much flu immunity in a number of years. And so we need to be mindful of that. We could see a situation either this year or next year where you have a really bad flu season, and if there's a mismatch between the flu vaccine and the circulating strain, it could be very bad, and then you're going to have COVID on top of that. So businesses are going to have to do things differently, and I think they ought to start thinking about that now, how they create a work environment that's safer for people to work in with respect to respiratory pathogens. So it's things like trying to de-densify offices, especially in the peak sort of COVID flu seasons, maybe allowing people a more flexible schedule of telework, allowing people to Zoom into meetings even within the office. You're not crowding people into conference rooms, putting in place better air filtration and handling so that the air quality is better in offices. You have hospital grade air filtration, trying to find alternative transportation so everyone isn't crowding on public transportation, maybe coming to work on off hours so you're not going on public transportation during peak hours. There's things that businesses can do, at least over the period of time when this virus is going to be circulating. It's sort of peak COVID season, to try to reduce risk and try to improve respiratory health. And I think we need to think about what that construct looks like.
Has industry adapted to the extent that it needs to, or is there more work to be done?
I don't think that businesses really have undergone a very comprehensive approach to how they improve the work environment, workflow, because people aren't back in the office yet, and most businesses aren't contemplating bringing everyone back into the office. And so they haven't had to contemplate what happens when we go back to work inside an office building full time. How do we improve the flow of people so that we reduce the risk that you're going to have the kind of crowding that creates these sort of, conditions for super spreading, if you will. That's going to probably be more likely a 2022 event. My guess is that, business isn't going to bring people back in full this year. Most businesses have put off their restart dates. And then once we get into the sort of density of the winter, I think there's going to be enough persistent risk from COVID and influenza for that matter that they're probably going to take a cautious approach. But we need to start thinking about this, because it's not just improving the air handling system. That's a key part of it, but it's changing the workday. The idea that you're going to have meetings in the office, people are going to be physically in their office, but they're going to be taking the meetings from their desks. You're actually using technology to facilitate interactions within the office. Those are the kinds of things we need to think about doing if we're serious about trying to avoid unnecessary interactions that could be conducive to spread.
What about keeping the people who are essential workers safe coming out of the pandemic? What kinds of systems do you see perhaps being proposed or even being put in place to improve safety for folks working in grocery stores or restaurant workers or other folks who are essential workers who don't have the ability to work from their attics?
You're seeing a lot of the vaccine mandates in businesses be applied to work circumstances where it's harder to social distance and harder to change how people flow in a work environment in order to reduce risk. So, the most obvious was the meatpacking plants. They ended up being very conducive to spread. You had people working very closely together in a cold environment that was probably more conducive to the spread of aerosols. And we saw some pretty significant outbreaks and unfortunate outcomes among people who worked in that industry. And so now you're seeing vaccine mandates be put in place in those places of employment. You're seeing masks being used aggressively on the job, high quality masks. And I think that's really going to be how we approach this. You're going to see more mask use in some of these occupations, particularly people who are in contact with a lot of people over the course of the day, like a grocery store worker who works on a checkout line, is in contact with a lot of people. And I think you're going to see more of an imperative to make sure people are vaccinated in those environments.
How important is it for kids to get vaccinated for us to feel like we can get back to normal and get back into the work environment?
Well, look, from a clinical standpoint, I think it's important for kids to get vaccinated. Even though the outcomes aren't nearly as severe in kids as they are in older individuals, this isn't a benign illness in children. You're still seeing bad outcomes in kids, and we don't understand the long-term sequelae of this infection. There's going to be some long-term consequences of mass infecting a significant portion of the population with COVID. This is a virus that does seem to have some lingering effects in a portion of the population. The UK had a study showing 1.8% of kids had persistent symptoms, neurological symptoms, at 2 months out from their infection. It doesn't sound like a lot, but if you're infecting tens of millions of children, that's a lot of kids on an absolute basis that are going to have some lingering effects of a virus that was otherwise probably avoidable. So I think it's important that we vaccinate the children from just a purely public health position. I think it's also important because parents still feel apprehensive about going into a work environment because they're worried about bringing the infection back into their homes. I know a lot of people, and I think it's more than anecdotal, who feel reasonably confident that they're not going to suffer a bad COVID outcome because they're vaccinated, they're otherwise healthy, they might be younger. But their concern is that they'll go into an office environment, get an asymptomatic infection or mild infection, not recognize it, and then bring the infection back into the home where they have unvaccinated kids. So I think if we want to really instill confidence in people to go back to work in a more robust fashion, we have to find a way to allow adults to be able to protect their children if they want to, and that's going to be through vaccination.
You have not thought that the way the Biden administration has rolled out its plans for workers to have to be vaccinated has necessarily been the way to succeed in getting the most people vaccinated. What do you think is the best way to increase vaccinations, and what will be the impact of this new rule?
The bigger debate is your decision to get vaccinated an individual choice, or is it a collective choice? Does it impact the community? I think very clearly it impacts the community. These aren't just decisions that people are making individually. Everything's an individual choice, but it's also a collective choice. And I think that that's a hard concept because most people think of healthcare decisions as, my body, my decision. But there's issues beyond that when you're, risking bringing in an infectious disease into an environment where other people are vulnerable. But I think to the extent that it is a collective choice and it does impact the community, if there are going to be requirements imposed on individuals about vaccination, it should be done at the level of the community, the environment that's being impacted. So a school board voting to mandate vaccines for a school district, or a business deciding to implement a mandate on its own. I think to the extent that we pull these decisions away from local decision making, it starts to have a political veneer and people start to harden their positions. And so I don't think governors should be telling businesses they can't mandate vaccination, quite certainly. And I don't think the federal government should be telling them they have to, because I think when you do that, you take something that's sort of furtively political and make it objectively political, and you're just going to harden the positions. The way to accomplish a high rate of vaccination was, I think, continue on the course that we were on. I think the administration was doing a good job rolling out the vaccine. The mandates on the federal workforce certainly is within the federal government's purview to do, and I think that provides a lot of cover to private businesses who want to impose their own mandates. And so it's just a question of, is the gain that you've achieved worth what you've done from the standpoint of creating a greater political debate around vaccination? And I don't know that the answer is yes. I don't know that the benefit in terms of pickup of additional couple of percentage points of people vaccinated is worth the impact that we're going to have right now, where this is going to now become a political issue. It's going to be a legal issue that gets litigated. A lot of businesses that might have moved forward with mandates on their own are now going to wait and see what happens. They're going to wait for the federal government to tell them to do it because they know that that may be coming. It's going to take the federal government months to implement this, even if they're not challenged in court. OSHA, the component of the Labor Department, needs to issue regulations. Then they need to issue guidance to businesses on how to implement those regulations. Then they need to give a grace period to businesses to actually implement the mandate. Then they need to figure out how they're going to ensure compliance. And so this isn't going to be something that happens quickly. And I think it may freeze the marketplace and have the unintended consequence of actually forestalling mandates that businesses otherwise would have imposed on their own.
So in your book, Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic, you really lay out what went wrong in this pandemic, that we essentially prepared for the wrong pathogen. We were expecting if we had a pandemic, it would be flu, and all kinds of systemic failures up and down the government, and you really take aim at the CDC. You point out that the intelligence community can play a much bigger role in preventing future pandemics. What do you want the audience to know about what we can be doing better to avoid this happening again in the future?
We need to build better capacities for actually being able to scale up a response, develop the antibody drugs and be able to scale their mass production, be able to quickly develop a diagnostic test and deploy it very widely. We need better systems for gathering information and doing analysis that can inform real-time decision-making. This is what CDC was supposed to do, but they were late. They didn't gather good information. They didn't put out good guidance. It wasn't put out in a way that was interpretable to people. It seemed confusing. It seemed conflicting. And then we need to be able to spot these outbreaks when they emerge in foreign countries. And that's where the foreign intelligence services come in. We can't rely on the good graces of foreign countries to just inform us when they have an outbreak of a dangerous pathogen. We know countries haven't been forthcoming, even friendly countries haven't been forthcoming with this information in the past. And certainly China wasn't forthcoming in this instance. They had information that was available much earlier that wasn't shared with the public, including they never shared the source strains, which would have helped us develop diagnostics and vaccines much earlier. So we need to have the capacity overseas to actually gather this information. And that's going to mean a much greater role for our intelligence agencies in the global public health mission, where historically they haven't really had a role.